Welcome, everyone. We are fortunate today to have with us Dr. Ogadinma McGeachy. Dr. McGeachy is a board-certified family medicine physician. She completed her medicine residency at Mount Sinai South Nassau Hospital in Oceanside and remains active as a community physician. She is currently the Director of Undergraduate Medical Education and Clerkship Director at Kingsbrook Jewish Medical Center in Brooklyn. She also serves as an assistant professor at St. George's University School of Medicine and American University of Antigua. Dr. McGeachy practices full spectrum family care for adolescents, teens, and adults. Her passion is helping patients implement positive lifestyle changes to achieve better health and life balance. Dr. McGeachy, originally from Nigeria, grew up in Brooklyn, and she's married. He loves spending time with her family. Dr. McGeachy, thank you very much for joining us.
Sure, it is my pleasure. Thank you so much for having me.
Thank you. You know, I'm glad to have you with us today for actually a number of reasons. I know that you are focused on helping people implement positive lifestyle changes to achieve better health, which is something I'm personally interested in. But professionally, as an audiologist, I'm concerned about whatever affects my patients' hearing and abilities. And of course, we know that there are a lot of different medical conditions that affect hearing. Some of them are not, people don't necessarily connect with hearing. So, for example, smoking increases your risk of hearing loss. People with diabetes are twice as likely to have hearing loss as people without diabetes. But also hypertension increases risk of hearing loss. And I know you have a special concern about the problems associated with hypertension and how to prevent those. I'm sure we'll talk about that. But before we get into those important health issues, I thought maybe our listeners would like to just get to know a little bit about you. So I thought maybe I could ask, when did you realize you wanted to be a doctor, and maybe what role did your family play in helping you reach your career goals?
Well, let's see. I don't really have an elaborate story, but I do remember when I was a little girl, um, I was always fascinated with trying to heal others. My friends would run away when there was blood, and I was the one, there. And I remember also voicing that love to my parents. I wanted to be a doctor, and they ran from there. They put me in anything science, anything that had to do with medicine, all the STEAM programs, or just any opportunity they got, they made sure that I was exposed to science. And after I became a physician, I loved it even more. I mean, I love helping make people feel better. And also, one thing I did realize growing up in Brooklyn is that I knew that there were gaps in care, especially with persons of color. So, what better way as a Black female board certified physician is there to help serve the community? And so, that's my goal, and that's what motivates me to continue daily.
That's great. I mean, I don't know. A lot of parents maybe would have just, maybe taken that interest that you had lightly and said, yeah, whatever. But it's great that they believed in you like that, and that's terrific. Um, we've talked a little bit before, and I thought it'd be interesting if you could just mention a little bit about. I know you've worked in hospitals and so forth, and you're working in education, in medical education, but you have opened a private practice, and I think it might be interesting. I was going to ask, what are some of the reasons why you decided to open a private practice?
Sure. Thank you. So, I've worked in various sectors of medicine, like you mentioned, whether it's in a hospital or a clinic setting or a group practice. But what I noticed is that I started paying attention to patients. patients want their time to be respected. They want to come to a doctor's office, receive proper care, and not have to wait for 4 or 5 hours for that. You know, patients also want someone to listen to them. They want someone to give them the proper care. And so while I observed all of that, I knew that it was just a matter of time until I opened up my own. And like I said, growing up in Brooklyn, I've personally experienced that 2-3 hour wait just to see a physician to be there for 2 minutes. And so my practice, on the other hand, my whole goal is to make sure that the patient is taken care of from when they walk through the door, you know, greeting my staff members until it's time for them to leave. So it really, it made me stronger in terms of being a better physician. I'm able to understand what they're going through, and I'm also able to provide adequate care for them. And the other thing I wanted to do also was to bridge that gap. There aren't many African-American board certified physicians, like I said earlier. And so being here, we can increase that access to care. And what better way to do it than to start my own practice?
Yeah, I can relate to that, you know, because before I started my own private practice, you know, I worked in different settings, and I knew how I wanted patients to be treated. You know, I try to put myself in their position. And I think what you said about respecting the patient's time, because you know what it's like to be on the other side, I think that's very important. And you know, you and I have talked before about underserved populations.
Absolutely.
Right, which is you know, is a problem. You know, it's one of the reasons why I helped to start the Lions Lend an Ear program, a program to help people that can't afford the hearing help they need. So I think that's, you know, that's great that you have that kind of a mission to help people that need help. If you would, if someone would ask you what's your philosophy of practice, what do you think is important for in your practice? What do you tell your staff about how you treat the patients, or what do you say is your philosophy of practice?
My philosophy is to treat someone the way not just you want to be treated, but how you want your mom or your dad to be treated. You want to have them feel welcomed. You want them to know that they will be taken care of, and whatever question they have, we're here to answer it. It's already difficult enough for them to come to you to, you know, ask for help, especially in a lot of cultures. It's seen as a weakness when you come and you mention that you have an illness. You're supposed to grin and bear it. And so my staff, whether it's, you know, you're coming in and they have a smile on their faces, or even being accessible online, you know, one of the things that can be frustrating is when you're trying to reach your physician and they're not available. I'm not available 24/7. However, I have put things in place that allows a patient to be able to communicate with me. So my philosophy is to be there for them and give them the adequate care. And I try to make sure that my staff embodies that, because sometimes you're only as good as your front desk staff. And with that negative experience, someone can leave, even though you can probably provide that service that they need adequately. So I would say that would summarize my philosophy when it comes to practicing medicine.
I think that's important you mentioned that. You know, I tell my staff that, you know, I'm not the first person that the patient sees when they come to the office. And, you know, we tell our staff that, in a way, treatment starts on the phone, because that's part of the first contact with the front desk staff is the beginnings of, you know, education, counseling. So, yeah, I believe that also. I know that you deal with, as a family practice physician, you deal with all kinds of medical conditions. And I'm sure that you know, as an educator, you know, I'm sure you have a lot to say about different types of medical conditions. But we've talked a little bit before about the issue of hypertension. And I thought I would like to, maybe if you can explain, why do you think, why should people be concerned about hypertension?
Okay, first, let me try to define hypertension in the simplest way possible.
Mm-hmm.
So hypertension occurs when the force of your blood pushes against the blood vessels, and it's doing that consistently too high. Mm-hmm. When that happens, a lot of things happen in our system. Unfortunately, you may not feel anything. You may just do every single thing that you've always done from before. Sometimes people may experience headaches, maybe blurred vision, or even nosebleeds at times.
Oh.
But we consider it the silent killer because it can also lead to heart issues. It can lead to aneurysms. And two of the things that we primary care physicians are very concerned with is leading to heart attack and stroke. So this is a very, very imminent topic to discuss, especially since you feel great, but the disease itself can progress. So that's one of the primary reasons I'm very concerned about it, because it doesn't always exhibit any symptoms, but yet it's something that's trivial to make sure that we pay attention to.
Right. If someone has hypertension, you're saying that they may not feel any pain, they may not be out of breath, they might not have those things?
They may not have shortness of breath. They may not have any discomfort, like I said. Now, by the time they start exhibiting those symptoms, it may be a little bit later on down the line. It may be late. This is when they end up presenting because perhaps, like you said, they're short of breath, or maybe they're having chest discomfort.
Right.
And then they come in. So our goal is preventative medicine. Our goal is to make sure that we find those patients, identify those patients, screen those patients, and we do that with every visit that we have. And we are able to treat those patients accordingly. But we can avoid hypertension. Okay. How can we do that? Well, it has to stem from our lifestyle. So we have what's called modifiable risk factors that we can try to avoid. These things include exercise and things that we already know. So exercising, decreasing the salt in our diet, for example. Other things we can do are smoking. You were talking about smoking and effects with hearing loss. Smoking can also, decreasing smoking can decrease our chances of having high blood pressure. Or alcohol, if we can also reduce our alcohol intake, that can decrease that risk factor. These are modifiable risk factors that you and I can implement in our lives, and that'll decrease automatically our chances of having high blood pressure.
So now, if someone, say, has a family history of hypertension, blood pressure, is that something that should make them more concerned?
Absolutely. Thank you for asking that, because that goes into our non-modifiable risk factors. Those are things that you're born into it, right? So the same factors that I mentioned earlier, they can try to avoid salt intake. They should make sure that they exercise. But we also have medications. We have a variety of medications that we use to treat hypertension. And luckily, they tend to work. And this is why we recommend that these patients who do have these non-modifiable risk factors to come in, whether it's for their annual physical or for a checkup. And with that visit, we can easily monitor their blood pressure and find out if they are at risk.
Right. So having so a person like having a regular annual checkup is an important thing for someone like that, then.
Absolutely.
That's important, I think, for a lot of people to remember. In my field, in audiology, we say, catch it early and treat it early. And I guess for a lot of conditions like hypertension, with hearing, if you let a hearing loss go too long, the lack of stimulation to the brain creates a lot of problems with clarity and other issues. So it sounds like it's probably better to catch a hypertension sooner than wait till it gets more advanced and try to deal with it then.
Absolutely.
Yeah, so that's important. I wanted to ask a couple of things about your practice. If a patient is thinking about coming to your office, your practice, what should they expect? What should they know if they're coming to your office for the first time?
Oh, perfect. Well, first of all, my office is right here in Valley Stream. So one of the things that they should make sure they have is just their ID with them, their insurance card if they aren't self-pay. And we practice social distancing, infectious control. So they must make sure that they cover up. They must wear their mask. And if they have any records from their previous physician, that'll help. It's not necessarily mandatory. I would ask them to walk with their medications if they had that. But most importantly, they need to make an appointment. And we have ways, whether you can go onto my website and make an appointment there so that can be seamless, or they can come in, even if it's just to introduce themselves and have that appointment scheduled.
And just in case people are interested, would you be able to give us either a phone number or a website, a way that they can?
Of course. Would you like me to give it to you now?
Sure, yeah.
Sure, okay. So my phone number is 516-758-7339.
Okay.
Our our online address is GOAL, that's GOAL, familymedical.com.
GoalFamilyMedical.com.
Correct. Once they go into the site, they can book an appointment. They can learn a little bit more about the practice. And we offer a lot of different services. So in addition to treating a lot of chronic and acute medical conditions, we also have vaccines. We do COVID testing. We also have, I'm a civil surgeon, so I also do medical component of the immigration papers, for example, if someone is trying to get their green card. So we have a lot of other services that are here in addition to treating medical problems. And they can come in and we will be glad to treat them. We're open Tuesdays, Thursdays, and Saturdays. Now, a lot of offices are closed on that day, but we capture those people who are working and may not be able to come during the weekday. And we also have late hours on Tuesdays.
Excellent. I think that's another way that you respect people's time when they, if they're working and they can't get there during normal work hours. So that's great. Well, I've really enjoyed speaking with you. I just have one more question.
Sure.
I have a nephew in college who's considering career options, and I know well, now a lot of college students are not in their normal classes. They're doing distance learning, and so they don't have the contact, maybe with professors and people that they normally would. Is there any advice that you would give a young person, maybe a college student, who's thinking about possibility of careers in healthcare or medicine?
Absolutely. We need you. Please come on down. I would advise for them to try to do a lot of volunteering. It might be a little bit difficult now because of the pandemic. However, volunteering in large settings like hospitals or even private offices, that'll really help. It'll make sure that they actually are exposed to what they want to do. Sometimes people have false beliefs about what medicine is all about.
Right.
So they need to see it early. The other thing I would like to tell him is to stay focused and make sure he completes the process just straight through. A lot of times students tend to take breaks. They're not sure what they want to do. And that, gap in career can be a detriment to them. So I would advise him to, we need him. The more physicians we have, the better. Who knew that, we would be needed so much and be considered essential workers in times like this. So I look for, if you want him to come to my office and do some volunteer work, I'm here for him. Well, but I wish him all the best.
Well, thank you. And I think for for any young person that's thinking about healthcare, medicine, even audiology, or it's important. I think you're right for them to see what it's really like. But I think you're a great example of someone who's has a mission and is focused on really on helping people. So that's great. So before we end, I would just ask you maybe to give us the phone number and the website one more time.
Sure, not a problem. The phone number is 516-758-7339. The website is goalfamilymedical.com. That's GOAL familymedical.com.
So Dr. McGeachy, thank you once again. It's been a pleasure to speak with you, and I hope to speak with you again soon.
Thank you. I appreciate it. Thank you so much for having me, Dr. Cardano. It's been a pleasure.
Thank you.